105.1 The Buzz with Daria, Mitch, and Ted. Let's welcome to the show cosmetic surgeon, Dr. Michael Workman.
Hello, hello.
Hello.
888-733-5105 if you have questions for Dr. Michael Workman.
He's the body guy.
I want to ask one real quick question, and then I also want to tell you and everybody what happened today, because it's kind of exciting for me. with a problem area that a lot of women have, I don't know about guys, but I've talked to a lot of women who have the same thing. It's the problem I have, and that it's this little, especially post-pregnancy, is this little like ridge of fat right above the belly button. If you were to liposuction that, could you go in through the belly button and have it be like no scar? Be quiet.
I hate belly buttons.
You actually could, and I think that's, sometimes we'll do that, especially if a person has a bigger belly button. If you have just a really short shaft on your belly button, it's tougher to do that. The skin oftentimes above the belly button, especially in women in their 30s, tends to lose elasticity, especially if you've been in a lot of sun, for a lot of sun exposure. So we have to be careful sometimes in terms of liposuction up there for women in their 30s, 40s, and 50s. So oftentimes we end up doing like a mini tummy tuck or tightening up the skin. But if it's just somebody really young like you and who has good skin down there, lipo I think would be reasonable.
No, because you said women in their 30s and I'm in my 40s.
Well, but you look like you're in your 20s.
Oh,
Good
stop
answer.
it! Stop it!
Good
You
answer.
look like you're in
Okay,
your 20s.
and then I have to share this really quick, and it's kind of to do with you, but kind of not.
Sure.
I have a friend named Debbie, and she's an esthetician. And I've known her for years, and she's just started working for you.
I know she has.
And she's wonderful. She's like this 6-foot redhead. And she's been doing facial stuff, like injectables and this and this and this. Well, she told me, and actually you, Dr. Workman, told me too, there's this brand new thing. Like it's just gotten approved. And is it called Ulthera?
It's Ulthera. And
Ulthera.
It's the only FDA-approved device that both lifts and tightens the skin.
You guys, this is like, remember we have always asked about like, what can you do about the jaw? What can you do about the jaw, the sagging jaw, the ill-defined jaw? Yeah. And this is like it. It's without any incision at all.
How does it work?
It works on the principle, well, first of all, let me just tell you that she did it to me today. And you probably can't see, I can already see, not just a difference, but a dramatic difference.
Wow.
And you're not even supposed to see results until like a month to 3 to 4 months.
Jeez.
I saw her before and after picture, and she looks like a different woman. Like, it's crazy.
So
it's the principle of ultrasound, like you would get if you had a baby, except you know how you would focus the sun through a magnifying glass to like burn an ant?
Right.
It's like that with ultrasound.
Okay.
So it does this thing, scientifically speaking, with this ultrasound, and it just targets, I got about 150, 170 pulses all over my face. I'm not going to lie, it's not pleasant.
Okay.
But it's not unbearable. It feels like if a bee stung you and wiggled its butt around for a minute before leaving.
100 and some time?
Yeah.
Woo!
But it doesn't, only about 7 of them, like, really were like, hi! Other than that, it's totally, but then immediately afterwards, you feel like your skin is gone up around your bones.
How long does it last?
As long as the natural process of aging.
Wow.
It just it's amazing.
So it's a brand new machine?
Well, it's been out for a year or two, but the nice thing about it is it not only tightens the skin, but it tightens the underlying area called the SMAS.
Right.
And to get the final result is probably 3 to 4 months before your collagen permanently, regenerates and tightens up the skin. Initially, you're going to have some edema, you're going to have that initial contraction, but you won't see the final result for someone young for 3 to 4 months. For older people with, saggier skin, sometimes it's 6 to 8 months before that collagen can remodel.
It's crazy.
Wow.
Yeah.
It is a non-surgical facelift.
Yep.
Like
That's incredible.
You hear about that for for years and years and years, and you're like, this sounds too good to be true, and then it is. But this is like this actually works. And she went to seminars and she tried it out, and she was like, Debbie, she can't believe. She's like.
And you can do it any part of your body?
I don't. It's only approved for the face right now, but they're doing tests on the décolleté.
Yep.
And they can lift the neck. Like I'm telling you.
Whoa.
I'm getting
This is
it
what
for.
we've been waiting for, like you said. Yeah.
Honey, seriously, like it's crazy.
This is Dr. McCoy using the little thing and just waving.
It is. It's exactly like that. Except you're like, Bones, you're hurting me a little bit, and I like it.
Price-wise, I know what your questions about
$800.
Okay.
I think roughly.
All right.
But like right around 1,000, and if you compare
Certainly less
that
than
to
a
a
facelift,
facelift,
right.
yeah, and the results are really, really, really similar, if not better.
Well,
It's
it tends to be
insane.
for younger women with good skin like yourself.
So sweet.
Yeah, I mean, it doesn't replace a facelift for people that are really saggy and whatnot, but it just kind of gives you a little oomph.
Debbie looks 10 years younger.
Man.
Like it's incredible.
Yeah.
She didn't. Her jaw is so defined now, and all she did was do the procedure. on yourself. It's crazy.
I'm in.
Okay, so anyway, that's my little. I just was like super excited about it, and it's called Ulthera.
Ulthera,
Ulthera.
correct?
Nuts. I like. It's probably premature for me to be plugging it so much since I just had it done this
Right.
morning.
Cut to a month. Your
Yeah, cut to a month where I look like the melting face in Raiders.
Don't look at me!
But I saw a difference from when I walked in and when I got back in my car and looked in the mirror.
Are there before and after pictures somewhere of
Oh.
people who have had it done?
Yep.
Yeah.
They're on the internet.
Okay.
Yeah.
Yep.
It's
I'm looking it
crazy.
up.
It's
Yep.
crazy.
The other thing is you don't notice it, but I can tell from here your nipples have actually started to go
Oh
up.
my God! He just said
Yes, my doctor.
The N-word.
Wow.
See, I had her do it twice on the back of your neck so that it, remember
that
the old
why?
joke about the
Tighten her up.
yeah,
my
about the
word.
ponytail, you know.
Yeah.
He really is a doctor. folks.
Heavens to Betsy. 888-733-5105. Questions about plastic surgery. The
I love Dr.
I'm a
Workman
little.
so much.
I'm
I flushed.
a little. Liposuction, tummy tucks, breast lifts, breast reductions, anything from the neck on down,
He's your
or
man.
of course in this particular case, Debbie's only in there on Wednesdays right now, but doing all sorts of face stuff. 888-733-5105. Questions? Summer's coming up. Less clothing worn. Make yourself look good.
Get beautiful. Philip Phillips now on the buzz.
Okay, my question is, I have very big boobs, and I have kids, and so after the breastfeeding, they're not as bouncy as I would like them to be. And so I know that there's a surgery called like the lollipop surgery or something to kind of tighten them back up. So I don't want to get implants or anything like that, but I just want to keep my original equipment, but just like perk it up.
Yeah, question, how much of your breast actually hangs below the fold? Is it more than an inch or so, or can you quantify how droopy they are? Not while you're driving, hopefully.
Do they wobble to and fro?
I don't know how to quantify that. Maybe like an inch. They're just not, you know how your nipples are looking up and perky? These ones are looking at the ground, kind of sad.
Oh.
Okay. Yeah, you probably need a lift, which involves taking some of the skin out above the the areola, and then we would take a wedge of tissue out between the nipple and that the fold, and that's kind of the lollipop lift I think that you were describing.
Because I've seen pictures of lollipop lifts, and they look terrible, and the scar tissue is awful, and so I wasn't sure how you could do a facelift on a boob and make it look good.
Sure. Why I think it's important to remember that everybody scars a little differently. I think some people, lay down really nice scars, but the other thing is you have to look at how old is the scar. And oftentimes it takes a year to 18 months before the scar fully matures. The other thing to keep in mind is that by putting paper tape or silicone sheet on a scar, you can get a much better result. And smokers don't heal well, diabetics don't heal as well. So, just looking at pictures without knowing the background doesn't necessarily tell you that much.
Okay, well, I'm not a smoker, and yeah, that would be really great. Thank you so much. It's something I've been wondering about for a while, so thank you.
Very
You're
good,
welcome.
Amber. Thanks and good luck. That's it for right now.
Okay.